Hi everyone, I'm Ohanya Doc. In this video, I'm going to discuss pneumonia part 2. I'm going to focus on risk factors of developing pneumonia, how to diagnose pneumonia, how to treat pneumonia, how to prevent pneumonia, and complications of untreated pneumonia. If you like this video and benefit from it, hit the like button, comment below, share, and subscribe. If you want to understand this video better, watch part 1 of this video where I've discussed what is pneumonia, the causes of pneumonia, how our body defends itself from these bacteria that cause pneumonia. Pneumonia is the inflammation of the lungs, and also it's the infection of the lungs, and also this infection and inflammation will result to signs and symptoms like cough, chest pain, difficulty in breathing. Pneumonia can range in seriousness from mild to very severe pneumonia. People who are at risk of developing pneumonia or severe pneumonia are one. We have children who are below 2 years. Children who are below 2 years do not have a mature immunity to defend themselves against these bacteria that cause pneumonia. Number two, we have elderly people who are above 65 years. Number three, we have people who have other chronic infections or long-term diseases. These are diseases like liver diseases, heart diseases, kidney diseases, and also conditions like asthma and diabetes. Those people have high chances of developing pneumonia. Also, we have people who their immune system is weak. These include people who have HIV and AIDS, also people who are receiving cancer treatment, also people who have some types of cancers like leukemia. And also we have smokers. Smoking usually destroys the cilia. In the other video, we discussed what is cilia. Cilia is the hair-like structures that line the alveolar. These help to beat up the mucus and bacteria that you inhale. Also, we have people who are, or patients who are hospitalized. When you are hospitalized, you are living or you are in close proximity with other patients who have pneumonia. These patients might transmit these bacteria to you, and you may end up acquiring pneumonia. How do we diagnose pneumonia? Pneumonia is diagnosed. One, your doc will ask you questions about your signs and symptoms, the color of the sputum, and also how on your deeper history. Then your doc will also examine you. They may take a stethoscope and listen to your chest. They may also ask you to do certain things so that they can examine you. And number three, your doc may also order tests and imaging studies. These tests include one, blood test. Blood test, we have one, we have a full hemogram. We also have another test we call a blood culture. We also have another test that we call a coagulation profile. All these tests will help to confirm if you have the infection, and also they may also identify the type of bacteria that is causing your pneumonia. Number two, uh, the test number two, we have a sputum evaluation. You may be asked to produce sputum. This sputum will be evaluated for the bacteria that is causing your pneumonia. Number three, we have spirometry or pulse spirometry. This is a device that is put on your fingertip to say the amount of oxygen that is reaching in your bloodstream. In pneumonia, there is no enough air that is passing from your lungs into the bloodstream, so you might have low SpO2. And we also have a chest X-ray. An X-ray is a standard diagnostic test that is used to confirm the pneumonia. It also can tell the spread of the pneumonia, and sometimes it can also tell whether you have complications of pneumonia. Also, we have a CT scan. A CT scan is a more modern diagnostic test. This one will give more detailed way of diagnosing pneumonia than an X-ray. How do we treat pneumonia? Treatment of pneumonia depends with the seriousness of the pneumonia, and also it also depends with the category of the pneumonia. Category means that it depends with how you have acquired your pneumonia. We have four categories of pneumonia. We have community acquired pneumonia, we have hospital acquired pneumonia, we have ventilator acquired pneumonia, and also we have aspiration pneumonia. Community acquired pneumonia is caused by different bacteria than hospital acquired pneumonia. These bacteria that cause community acquired pneumonia are treated differently from these other bacteria that cause hospital acquired pneumonia. Community acquired pneumonia is caused by bacteria like streptococcus, Haemophilus influenza, Mycoplasma, Chlamydia, Legionella. These bacteria are usually treated through antibiotics like macrolides, fluoroquinolones, penicillins, cephalosporins, and also community-acquired pneumonia. Most of the time, you are treated as an outpatient and you go home. Hospital-acquired pneumonia is the pneumonia that is acquired when you are admitted in a hospital more than 2 days. Hospital-acquired pneumonia is caused by very nasty bacteria like Staph aureus. We have Pseudomonas, we have Klebsiella, we have Enterobacteria. These are very nasty bacteria that sometimes can resist to antibiotics. Treatment of hospital-acquired pneumonia mostly is done as an inpatient because these nasty bacteria cause a very severe form of pneumonia. Antibiotics that can be used to treat hospital-acquired pneumonia, we have a combination of fluoroquinolones with macrolides, and also these combinations can be added drugs like antibiotics we call carbapenems. We also have other drugs like ceftazidime, and also we have other medications like piperacillin. Hospital-acquired pneumonia sometimes it's life-threatening, so it's treated in a very serious, and most of those antibiotics are very expensive. What are other reasons why you should be admitted or why you might be admitted when you have pneumonia? One, if a child is younger than 2 months, that one is used as a criteria for admission. When an elderly person is older than 65 years, that is also used as a criteria for admission. Number three criteria for admission, we have if your blood urea levels is very high. Number four, we have if your breathing rate is more than 30 breaths per minute. Number five, if your blood pressure is below 90/60. And number six, we have if you have nausea and vomiting and you cannot be able to tolerate or take oral medications, you might also be admitted. When your temperatures are too low, that is also a criteria for admission. And also when you have labored breathing, and also when your oxygen saturation is low. How do we prevent pneumonia? Pneumonia is prevented through vaccinations. We have around two types of vaccines. Vaccine number one, we have PPSV23, and also we have PCR13. These type of vaccines prevent you from getting pneumonia. They usually help your body to build an immunity. So when these bacteria try to cause pneumonia into your body, this your body or your immunity will prevent you from acquiring pneumonia. Also, we have supplements that can help you boost your immunity. These supplements are very many. And also we have other ways that can help you on preventing pneumonia. Other medications that can be used to treat pneumonia, we have fever and pain relievers. We also have cough medications. We also have supplemental oxygen. We also have intravenous fluids, and we also have respiratory therapy. What are the complications that can occur when you have pneumonia that is not treated? One, we have lung abscess. Lung abscess is a boil of the lungs. Number two, we have a pleural effusion. Pleural effusion is the accumulation of fluid between the lungs and the chest cavity or the ribs. There's a potential space there that we call the pleura. Fluid can accumulate there, causing what we are calling pleural effusion. We also have septic shock. Those bacteria that cause pneumonia can move from your lungs and enter into the bloodstream, resulting in a very severe infection leading to septic shock. Number four, you can also get meningitis. The bacteria that cause pneumonia sometimes also cause meningitis. So these bacteria can move from your lungs through blood and enter into your brain, causing meningitis. If you like and benefit from this video, hit the like button and subscribe. I'm on your doc. Thank you.